bring our meeting to order and pledge the flag. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Under public comment, Charlie's going to make a statement.
You know me.
Okay, that's enough. Hold the applause, Don.
I just want to show something that we had an opportunity to do with it. You have to know about a couple of, I don't really know how long ago, but the Schmink Museum gave the district, as a lot of people have given us things that are remembrances of the history of the hospital. We had an opportunity to get something that I think you all will find very interesting. And we just had it reframed. This is a picture of the original founder of Lake Health District. And it says, Dr. John Irving Russell, founder of Lake Hospital, 1913, courtesy of Schmink Museum, Memorial Museum, and Dr. Russell family.
Oh, very
So
nice.
this is not a photograph of him, it's an actual drawing of him. The coloring, that, aside from the printing, the coloring that's a little different is probably because sometime in the history between when this was done in the 20s or so, glass broke, and it was not preserved properly. So we will be displaying this in the hospital in honor of our founder, or at least the first one.
1913.
1913.
I do not think I've ever heard this name.
No, I don't
I'd
know.
say this is completely new to me.
Yeah.
That's
Me
awesome.
too.
And we just had, I mean, it's now preserved in museum quality.
Yeah, we need somebody to write up a little history and put it in our webpage.
That's true.
That-
We'll work on that. But I thought you might find that.
But we have a writer.
Thank you, Charlie.
That's cool.
Consent agenda item. Anybody have any comments? If not, I'll ask for a
I
motion.
move we approve the consent agenda items as presented. Second.
Moved and seconded. Those in favor?
Aye.
Thank you. Approved. Financial report, Cheryl.
Well, I'm sure you all noticed that you got your financials at the last minute, because it was a rough, it was kind of a busy, I don't know.
I can do that.
Good.
I don't know what was coming up here.
So we had our auditors here last week, so we were scrambling to close and work with our auditors in the same week, which was hectic, but pretty successful. We had a good experience with our auditors.
It's backwards.
Right. It's backwards?
Yeah, that should be up there. That should be
The
there.
mouse should
Oh.
show on the screen. This one is big.
There it is, right there.
No, on the screen.
Oh, there it is.
Good, how are you?
It does, that's what I did this morning. Wow. Okay.
Thank you.
Cool, thank you. So, gosh, we've done this before. So anyway, we did get our financials done, kind of at the last minute, and I didn't really actually finish the Goose Lake and Lakeview Gardens financials until today, actually, but I did get them done, and I'll send them out. Fortunately, we had kind of a good, positive, slightly boring, nothing exciting month, which is good for me. Patient counts for the hospital. We had high numbers for hospital patients. That's actually last year's monthly average number, but still the way it's been going this year, that was pretty good. The ED was down a bit, Surgical inpatients was pretty high, surgical outpatients was average, and swing bed patients were very high. These people kept the hospital hopping in September. So overall, we had 94 less patients year-to-date than we did last year at this time. Looking at our ancillary services, lab is down slightly year-over-year, as is radiology, though radiology had a good month. Rehab continues to go crazy, and they're 580 patients ahead where they were last year at this time. Home health, which is always unpredictable, is a little bit slower than last year, and the health clinic is going right along with a good patient number at 972. Our monthly revenue for the year, these are our current months right here. Our revenue for the month was $2.68 million, which is just a touch below what it was last month. Of that, just 200 of that is due to the wellness center, so the rest of it is the rest of the hospital, so that's good. Our monthly average is at 2.6 million, which is 200 above where it was last year at this time. Of course, it is still very early in the year. Our days in AR came down from 86 to 81, so it's good that it's going in the right direction. However, our cash receipts, which are, yes, the orange bars here, which are not bad, but looking at our average monthly is 1.7 million. Well, last year the average monthly was 1.8 million. So this means we should be collecting more money than we are. So, but we knew that. Our days in the air is still high. Other than that, our days cash on hand is at 103. We are very close to funding the bond. If we got back our $2 million that we had spent on long-term care, we'd be at 136 days. And then we'll also be able to move that $500,000 that's currently in restricted funds. It's not showing up here. We'll be able to move that into out of restricted funds. We'll spend it, but still. So, not bad. Well, I mean, it looks kind of scary, but it's going to get better. Not in October, but it won't really look better till November, when we actually get the money from the bond funding. So, the profit and loss for September, our revenue was way ahead of budget, partly because of the wellness center. Our wages are above budget by $46,000. 35 of that was from the wellness center. Benefits are a little over, and materials and services of that $99,000, $70K of that is due to the wellness center. And in the month of September, we spent $38,000 on various building improvements. So I'm still working with the CPA about how to go ahead and recognize some of that money as revenue, but they are really deep into doing everybody's, this is the cost report month, so I don't think I'm gonna get an answer until probably mid-December on how exactly I can do this. Because they're doing audits and cost reports, and I'm just not gonna get the information I need. That's okay, I mean, we'll be able to catch it up and make it look better. I do feel like we'll be able to recoup, you know, at this point, I see there's at least $75,000 extra that we've spent above and beyond a normal operating expenses that we should be able to pull out of that money and record as revenue.
Just as a reminder, the money that we got from the county is in a restricted fund.
And it's not all here yet. I mean, it wasn't all here until, I think it came the rest of the year. And there's another 70,000 that's yet to come. And I have not been collecting all of the waiting on a state allocation money, and that still is coming through the county, so it slows it down a little bit. And another thing that's going to be really positive in November is that's the big month we usually collect almost $1 million in taxes. So that's going to be a little boon to our cash as well. Okay. So then our operating gain was, our loss was $12,000, much well above budget. The net gain for the month was $152,000. That brings us to a year-to-date gain of $41,000. So we are very close to budget overall. All right, and this is the balance sheet for Lake Health District. This is August, this is September, and I think what's noteworthy here is the cash kind of looks to stay steady, 15.9, but the fixed assets go up by $1 million. So we took in an extra $1 million from the county, and then we turned around and put it in the building. So it's kind of goes straight to that increase right there. Other than that, there's really not anything noteworthy that happened on the balance sheet. No changes. So, any questions on Lake Health financials? Oh, I think I have one more slide I forgot. The Wellness Center, which really is kind of I told you there's the $38,000 that we spent on maintenance and repairs for the building. This is what we'd expect wages to be. This is gonna go down because we're not gonna be paying CCS anymore. So, however, at the same time, wages are gonna go up as we've been bringing new people on board.
How do you come up with the revenue, just prorate that?
Right now until, yes, because I know, I get reports from Gobi and from the state allocation, and that's the revenue I am certain of. We've met with Credible about the billing situation, and there's a lot of things that we need to sort out with the billing in Credible.
Credible is the software that is used for the wellness center.
So I know there's some other billing going on, and I know there's some other collections, but our staff is trying to make sure that we understand what we're doing, so I'm not reporting any of that revenue yet, because I am not sure of it. So at some point, we'll play catch-up, but we had Credible come out a few weeks ago, and we had intense
Yeah, 3 weeks,
training.
3 weeks ago.
3 weeks ago? And that was hugely helpful, but we have some work to do on that. So I'm just reporting what I know for sure. for now.
That is not, none of that is the 1.2 million.
No, oh no, no, this is actual funds that they'll send over. The state money's always gonna come through the county, because that's where the contract is, and then the Gobi money will come directly to us. But there are some billings to other insurance companies, and there's some cash, a lot of cash received, like from a lot of the, there's a lot of co-pays and stuff.
And is that by statute, the money goes directly to the county? And then is turned over by the county, from the county to the district?
Well, yeah.
So, just, we are in the midst of a state audit right now. They came this morning, and we'll be leaving tomorrow after we finish. And the way the contract with the state, actually the way the monies flow, is from the federal government to the state of Oregon, from the state of Oregon to each county. They're called a QMHA, Qualified Mental Health Authority. The county then either delivers that service itself through a CMHP, Community Mental Health Provider, or contracts with somebody. So in the past, the money came to the QMHA, and then it flowed into the CMHP. They were one and the same. Now that they've been separated, the money from the state goes to the county then transfers that money to us. The county is still responsible for some reporting of the services that we deliver. Good example, easy example, is there is specific money for gambling issues, people that have an addiction to gambling. And that comes from lottery dollars, I believe. And those dollars have to be tracked by the county and reported. So we have to report specifically if we have any clients that have this addiction, are treated through them. But the county is responsible for reporting them, not the district, as the CMHP. So it'll always flow that way. The contract with Gobi is directly to us as a CMHP. Yes, sir.
How are we doing with the maintenance aspect? I see a fairly large number. I know you had some heating issues and some soundproofing that you were,
I can talk about it now, or I can wait until after we finish the financials during my report.
I have a question. You send us a report by zip code south of the
Yeah,
border.
yeah.
And I can't make sense out of that.
Oh,
It's between year, I mean, you've got.
well, it needs to
like-
be updated anyway,
Okay,
so,
that's something I should sit down and talk to you about someday.
yeah, well, yeah, that would be helpful, so I could, maybe we could talk about how we could make it more useful, more meaningful.
The date spreads, and then you had like 3 different,
I did it quarterly, so it shows a quarterly year-to-date, so each of those quarters was year-to-date.
I'm not okay. It didn't make sense to me the way that was.
Oh,
Okay, I'll give it.
okay, that would be good, thanks. Okay, and we should have updated it on this go-round, and we'll blame it on Brian's baby Oliver, who came along and work plan, so.
Blame it on the baby.
That's what it was called. All right, so then we're done with Lake Health, moving on to Goose Lake. Lakeview Gardens had another pretty good month. They had 670 patient days, which is a little bit less than the previous 2 months, but really it's not significant. And we were 457 days ahead of where we were last year at this time. Oh. What? Oh, I'm sorry. Oh, sorry. Yeah, it was a great month. When you look at the rate.
I wasn't sure what I was looking at.
I'm so sorry.
Carol.
Okay, never mind. Great. Oh, moving on. Revenue is right here, and the revenue for the month was, I think, 199,000. So the last 2 months are super close together, not surprisingly. The average monthly revenue so far this year is 190,000 a month. That's good. The profit and loss, there's the revenue. Their bottom line for this month was $32,000. Their year-to-date is 49. So last year it was negative 37 at this time. So this is excellent. It's kind of at a place where we can add a person without having to add a lot of staff. You know, it kind of goes up the stairs, so we're in a happy place where we can add revenue without adding a lot of expense. So that's a good thing. The balance sheet for Lakeview Gardens, it's true that their cash went down because we put it down here and applied it to their debt, so their debt has gone down by a few $100,000. I mean, last year at this time was 1.6 million, so that's a pretty great thing. Oh, I'm sorry, any questions on, that was it for Lakeview Gardens? Any questions?
Cheryl's got a long day.
Goose Lake Medical, the revenue for Goose Lake was impacted by the fact that Dr. Gilbertson was out for the month on medical leave. So, so our revenue was down at 43,000 for the month. She came back in October, part-time, so we'll still see impact in October and November, I believe, as she recovers. So right now, we're pretty close as far as average monthly revenue, we're pretty close to last year.
Cheryl, do we get any Medi-Cal reimbursement down here? No, we don't get Medicaid in California, it's Medi-Cal.
Yeah, they get Medi-Cal.
Do they get it? Have we had some payments?
Oh, yeah, we
Okay.
started getting money. Oh, yes,
Okay.
yes. We
Okay.
have. We have started getting some money. The loss for the month, which I didn't show on here, was $10,000. Our loss year-to-date then is $7,000. Last year at this time, it was $33,000. And their balance sheet, there's really no change. We generally keep the cash really low and try to pay back the debt, and we have started started making deposits again for us. And, okay. Questions? Okay. All right, exit. Sure.
And everything?
Yes.
Weird data update. Steve?
Well, the IT guy's gonna do some handouts instead of
Oh.
digital presentation instead, so.
Awesome.
Are we gonna hand those out, Rick?
Oh, sure, thank you, sir. So this is a, Clear Data is a company that Lake Hill District has contracted with to do a lot of our, to help us with our security assessments. And the first, we entered into a 3-year agreement with Clear Data to help us evaluate some of our security vulnerabilities and where we're lacking HIPAA, and physical security, and IT security, digital security, physical security. They specialize in first the HIPAA security assessments, basically, and then they have an ongoing relationship where they meet with you. They'll meet with me and the HIPAA security officer and the compliance officer every month, and then there'll be a quarterly meeting that they'll meet with us to discuss, where we're at, where we're going, and so they'll help us push us along for the next 3 years to get us where we need to go with regard to, policies and procedures, making sure they're up to date on our security and our evaluations, and we're not vulnerable. Because typically what's happening, and the reason why we're pushing this, and we did push this, is because, as you know, in the headlines, there's been a lot of data breaches and security breaches, and just recently, about 3 months ago, we had ransomware on our network, and thank goodness for backups, right? I mean, so we had some good backups, and we had to restore and lose a few hours of data, but without those backups, we would have been really hurting, right? And so what happens is in the wild, wild web, right, that we live and work in today, there's a lot of vulnerabilities, there's black hats and white hats, and so this is basically a security, this is what I passed out a security remediation roadmap. And so this is a walkthrough that one of the staff, a kind gentleman, came over, a security professional, and he did about a 2.5 day walkthrough with me. And we started in Alturas, and we went through all the facilities, wellness center, all through the hospital, all radiology lab, and did our HIPAA security assessment, in which they're trained to do that, and they've done this for several of the hospitals throughout the country. And then we ended that, and we did at the afternoon, we got a bunch of departmental managers in and asked them a bunch of questions, and just got a lot of information with regard to, what our vulnerabilities are and how can we improve our services, and how can we improve our security here. And at the end of the next day, we ended it at Christmas Valley, because we have a facility up there now, and so we drove up there and did just a quick little walkthrough on their site too. And so it was a really good visit. And as a result of that visit, the fellow I'm working with, James Riley from Clear Data, gave me this remediation form and gave me a HIPAA security assessment report, in which he's going to come back later and give more detail for us. But I'd like to highlight the first 3 on here, just for the board here, so not to go into too much detail. But if you want to, you can go through all these other medium risk levels. But we determined that there are three basically high risk levels that we would like to address. And we can address this over a period of months and a period of some of them will require over 3 years, because it's some of it involves some cultural changes, some of it involves some deep technical changes which require financial backing, things like that, right? So I'll start with the first one, which is basically an evaluation. So basically, Lake Health District is required to perform periodic technical and non-technical evaluations. Keep in mind this evaluation was administrative only. It was not a technical evaluation. They did not actually do, they call it a penetration testing and vulnerability scanning. That means they pretend like there's someone on the outside trying to penetrate our network, right? And so that's the next step. And so right now he's recommending, hey, we need to go to the next step where you need to actually hire a third-party company to go in and do vulnerability scanning and penetration testing into your network. So we have these public IPs for our Exchange server and our firewalls and all the things that we have that are out exposed to our network. And he wants to look at that from the outside entity and actually, do some testing and evaluation from the outside to find out what our vulnerabilities are. And he wanted, he stressed to me, he says, there's Department of Human Health Resources, I think that's the company or the organization that actually runs this, but they're the ones who come in and do the audits, the HIPAA security assessments, random audits on the hospitals to find out what they're, what are you doing to remediate? What's your game plan? What is your roadmap in order to fix these things? And so this is a really good start, and he's recommending evaluation because we really don't have a formal evaluation set up for Lake Health District Hospital. And so this will set us up nicely for the next at least 3 years where we can get ourselves launched, or they can help push us to the point where they can hold us accountable, right? So for the next 3 years, they're saying, okay, where are you at with this policy? Where are you at with that tech? Have you done that technical assessment and evaluation? So basically, he's saying periodic technical and non-technical evaluation. So going around and doing HIPAA security assessments on our own, educating our own staff on how to do that. Looking at the physical aspects of it, which I briefly mentioned it too. So basically, we weren't doing that before, and this is really the first process in which we are, going down that road. And their recommendation is to set something on an annual basis for EPHI, the electronic patient health information, right? I mean, this is, as we know, like the HIPAA security rules, it's highly protected and security information. So that's part of that recommendation as far as that. So we can go to the next one. If you guys have any questions, please interrupt me because I have a tendency to ramble.
Are these in the order that you would like to see them completed?
Yeah, I think the first three, in my mind, I think having that physical penetration is knowing how are we vulnerable, from a physical point of view, is very, very important. So I think I would recommend the evaluation of the technical security evaluation be number one, right? And so, and we talked about this, James and I did talk about this before we laid this out on the roadmap to make sure we were all in the same sheet of music. The second one that's high that I wanted you guys to know about and let Charlie and everybody else know is that basically right now we don't have any of our mobile devices encrypted. And that's a huge, huge, huge vulnerability. It's really close to number one, which I spoke to you, Gerald, with regard to that one. There's like a tie for these first two. So the number one breach around the country for HIPAA being stolen and information being stolen is our laptops. It's the number one, hands down. You're talking about probably 60 or 70%. If you go to the Department of Health and Human Services website, they have it's called the Wall of Shame. And so on the Wall of Shame, they have all the breaches of all the hospitals in which they name all the hospitals, and they specifically say what was the device. You look at that, and probably about 60% of them are laptops, right? And so really what it is because they were not encrypted. When a mobile device is not encrypted, that means if that laptop were to get stolen and they try to take it, they couldn't access the data because the data is scrambled, right? So you have to have a key or an access password or something to get into it that would be protected by the IT department or given to a general security. A person like Cheryl using it, I would give her access because she uses it. So it would really help with the vulnerabilities. And so if we did get one stolen and if it wasn't encrypted, then we would be scrambling to find out what the explanation was and trying to figure out, okay, what was on it, and was it encrypted, type things like that. So it's something that he wants me to make a priority with, and so to set it up as is one of the first things that we work on, is trying to encrypt our mobile devices. Yes, sir.
Is the encryption software gonna slow the device down?
Just ever so slightly. It depends on what software that you have to use, you choose to use. There's so many products out there that encrypts data. What I would want to do is evaluate the type of products out there. Right now I'm looking at BitLocker and I'm looking at Semantic. It's two different type of options to use that. But there are some that slow it down more than others, and I guess you have to look, I don't want to impede on workflow, absolutely not, and I just want to have basically a single process login, where they come in and they're accessing the laptop. I don't want to add extra layers of security and really irritate everybody.
And I was under the impression that most of our laptops act primarily as a terminal, working through the cloud type.
Some do, some don't, sir. Some are used to, like you're saving data, and we have thumb drives that put your data on the computers. We grab it, people copy and paste it onto the C drive. I mean, there is no guarantee out there how, if I check out a laptop or where a laptop's at the facility, where it's at and how it's being used, I cannot control at this point, right? And so having it encrypted is, I think, extremely important from my perspective. So, yeah, I mean, some of them are used for cloud-based, and some of them are not. They're used for different purposes all over the place, right? There's a myriad of ways.
If we're dealing with the CPSI information, patient information, does any of that get loaded to a terminal?
CPSI?
To a laptop?
Well, what happens, you look at specific like EHRs that we have. We have eClinicalWorks, we have point-click care, we have CPSI. Some of those features, like they bring up a PDF. You can bring up a PDF to view PDF. They have the option to go file and save as and choose exactly anywhere where they want to save that, right? And we don't know exactly if that's happening or not, but it is, you have the capability of doing so, right? So having it encrypted is really like a, good, we're good, right, type of thing. And so that's what this company is recommending, that we really get a little bit more prioritized on what we're doing on our mobile devices, both thumb drives and laptops. So
That doesn't mean you have to do it on the server.
on the server, well, they made a recommendation on the server saying if the actual data on a server is not encrypted, they want to know why. And they'll give you exceptions, the government will give you exceptions to the rule as to why the server is not encrypted. And it depends on where the server's at and where the access controls into the server are. How protected is the server getting into where it's located? And if it's not protected and they feel like it's vulnerable and it's not encrypted, then they're probably going to have issues, right? So it's, and just for the last point, and not to belabor this too much, is the last high priority that I'm going through is policies and procedures. So, as like I was saying, we talked to a lot of people, a lot of the managers, we talked to clients, we talked to, all the radiology and all these different managers that came in. And basically what it is, it says we're required to implement reasonable and appropriate policies and procedures to comply with standards, implementation specifications for the HIPAA security rule. We have implemented a few of these policies and procedures to comply with the HIPAA security rule. However, they found that we're not able to provide all of our HIPAA security rules and policies and procedures required at the time of engagement. So basically what they've already done is provided me a list of templates that we can use to create these HIPAA security rules. So there's a lot of administrative work that we need to do in order to shore ourselves up, because the government will look for not only are you doing it, but proof that you're doing it, right? And are you in compliance with doing it, are you enforcing it? So that's one thing that we're lacking is policies and procedures. And that's one of the reasons we got into a 3-year contract with them, because we wanted to, they specialized in policies and procedures. That was their specialty, that's what they really, that was their forte. And so I can tell right off the bat they are really good at that, because they gave me a list of, like I said, tons of templates. And so I've been sharing it with my staff going, okay, let's divvy up this work and start working on this. So we've got a lot of work ahead of us, but in policy and procedures is one of them that, you know, when he was asking for certain things, we weren't able to provide it to him, right? And so, but I just wanted to highlight those three, and wanted to go through and see the medium, the low ones, by all means, and let me know or email me any questions on it. But I'm pretty excited about this because it kind of gives me a roadmap for the next 3 years and gives me a game plan, which is going to get us in compliance with a lot of different things. So, very good.
One thing about policies and procedures, you have to have the training and the follow through with staff.
Absolutely, yes, sir. Yes. And that was one of the things he said, and actually a recommendation here. I think it's maybe on our medium. He said, oh gosh, what was it? Sanctions. It's actually number 4. And so if you look at number 4, it says to be effective as an organization-wide, need to clearly articulate and enforce its sanction policies on a consistent basis and hold workforce members accountable. So he, after interviewing several people, he determined that, okay, it's a good thing to have a policy, but it's another applying what that policy says. And so he's actually called that out as a medium security risk for us, actually. So interesting, huh? Yeah.
Okay, thank you.
Thank you.
Nursing report, Teresa.
Wow.
Read along here.
Well,
Wake up, you're not doing your
wake
homework.
up, I was listening. Well, I just have a couple things to tell you. I'm happy to report that the last traveling member of our surgery team was hired this week. So we have a commitment. It doesn't start until December, but one of the travelers signed on as our lead scrub tech. So hopefully by the first of the year, most all of the bills to the agencies who've been providing us with various members of the surgery staff will stop, and that will help us in our surgery department with our revenue and expenses. So I'm happy about that. Stacia Camp, who's done a lot of our assistance with scheduling in acute, as well as coordinated the hospital's CPR program, was accepted into the nursing program for Boise State University. So she'll be leaving by the first of the year. And so our CPR hopefully will be coordinated by the new surgical scrub tech. So those are just a couple little changes that are going on in nursing.
Will Stacia come back here?
She hopes to.
Oh,
We'll see. Boise's a nice place. So.
yeah.
Yeah, I think that's her intent. Yeah. That's all I have. Unless there's
All you
something.
Okay, we got some QI policy from Don.
Yes, so the QI policy was sent to all the board members. I don't know if you had a chance to review it or not. So I just want to briefly say that this was updated. I think the last time it was revised was some years back. So the new addition that I have made to this policy is put a guideline for the responsibilities of the departments. In the past, the departments used to identify new measures to be tracked every quarter or every other quarter. So we were not able to trend the improvements or go back and see if the improvements have sustained or not. So with this new addition here, that the department heads will be recommended or requested to identify some indicators that they want to track for the whole year. So then that will help in 2 different ways. One is track the improvement and see if we can sustain that improvement. And the other would be to help the department heads in spending less time in trying to think every quarter on what my quality measure is going to be this quarter. Because many of our department heads are clinicians and they have patient loads as well. So with this, I'll be working closely with the department heads to identify the measures, work with them on a method to collect the data accurately so that they can keep doing that throughout the year. We might change where the data is collected based on the improvement that we see, but that is the major change, is how we will be looking at our QI for the year.
Okay, we need a motion on that.
To accept it? Yes.
I'll make a motion to accept the QI policy as presented.
I'll second that.
Moved and seconded, those in favor?
Aye.
Aye. Motion passed.
Mr. Chairman, if I could just ask Don to talk a little bit about the status of the lean program that we're working on?
Yes, yes, it's been
JPIA Oregon.
very exciting. Thanks, Darby. So last week, Kelsey, Vanita, and I were in Burns for 4 days. We had a Purdue advisor who was there, and all the 4 hospital members were there. We got training on our lean program, and so now the Purdue person is going to come back to our facility next year, and they are going to be here for 2 days in April, and then each one of us will be running events. So what we are doing is we are looking at the clinic process from the pre-visit planning of when the patient is going to come to the clinic to when we refer the patient outside the clinic. So we are looking at the entire process of patient being registered, patient being triaged by the MA, being seen by the provider, the checkout process, and then being referred out. And this morning, we had the first staff meeting where we brought some of the lean tools to the staff members, the front office and the back office staff. And they all were fired up, and they're like, oh, we're gonna take this back to our workspace and see what we can identify. So this is really exciting. We're starting to work as a team, and we have the same idea with the providers is to start talking to them about our lean project. And they're going to see improvements in things being more standard, people not running around to find the information last minute, and there's gonna be less waiting for things and better flow. That's the whole goal of doing the lean project, and all of us are really super excited.
Now, Mike just recently had a clinic visit, and I got 2 emails telling me that I was supposed to come at that time. And neither of those provided any mechanism for me to say okay.
Okay.
So then I got a phone call, which that I okayed it, but I mean, you could automate that process.
Yes, and that is the patient portal use that we are looking at the same time. So that's great feedback. So we will look into that, and we would definitely like for the patients to, if they can electronically say yes, that would definitely reduce our phone calls being made to confirm the appointments. And that is something we are looking at patient portal through our Patient and Family Advisory Council. Dawn is a part of that council, and we are looking at patient portal use through that as well. Thank you for the feedback.
Then I've also had another doctor has a computerized telephone call that you can answer, that you're gonna, you understand, you're gonna be there.
Okay.
So there's that mechanism too.
Right, but we might not go to that one, that kind of a system at this time, because sometimes when we are confirming appointments, we are confirming if the labs that they were required to do or any of the ancillary services like radiology, if they have done that or not. If not, we offer them that we would like to reschedule your appointment. But that is not at this time, but maybe long term, we would definitely look into that as well.
Okay.
Thank you.
Anything else?
Yeah, I would just say I had also a visit to the clinic. The issue that they seemed to have, which delayed it for me, was finding some back records. Hadn't been there for a while. They needed to check on something, couldn't find it, and caused a delay. So I don't know if they're working on that or how they're handling that. But
Yes, we are, because right now some of our records are on paper and some of it is electronic. So one piece of this lean project is to make sure everything is electronic and train all the staff to be able to find the records at the right place. But I understand that's another piece that we are working on.
Wellness Center report, yes, Charlie,
We didn't vote on our motion.
oh, we didn't, I'm
Yes.
sorry.
yeah, we did.
No, we didn't, we just
I
said.
said yes, yay.
No, I said
Yeah.
no.
It's up to Jen. We're okay.
Good.
Thank you, Jen.
Could I ask a quick question in here, just because it has to do with, it's not a non, but a Jen, that that meeting thing you sent us today, or yesterday, about the meeting on the 16th, where you hit yes, maybe no on the
Outlook,
ballot.
the Outlook.
Does that automatically come back to you? Because I hit my response, but I couldn't tell that it resent it back,
Yes, when you
resent
hit
back
the
to you.
response, it does come to me telling me, you know, if I sent it to 5, it'll tell me 2 accepted, 3 declined, and then I can look and see who declined. So yeah,
Oh.
I get that
You
notification.
get that back, okay.
That's the kind of thing that would be nice instead of a phone call.
All right.
Okay, Wellness Center report, I guess, Charlie, you can do that one?
Yeah. think Trace was, well, let me just say that we are right in the middle of the audit by the state. So they showed up this morning at 9. They worked all day today, and then there'll be some additional surveyors here tomorrow. And it'll exit, I think, around 10 or 11, give them a chance to drive back to Salem. So I think she was probably working on some of the other materials that they were going to present. So with the ending of the agreement with Community Counseling Solutions, we've made Trace the acting executive director. So she is filling that role. Keep looking for adding additional staff to all that we're doing. So we're sorting out who's on first and how is that going to work. And we have high hopes for how Trace will do. We have hired 2 new people. Jane Lincoln, who's a licensed clinical social worker, lives in Paisley, and she will be working part-time, but available to work also up in Christmas Valley, where we have great need. We've also hired a prevention coordinator. Her name is Francine Withers. She has started this week, was it? Or was it last week?
It was Monday.
She started Monday. So one of the roles that we are contracted to do is to have programs to encourage school-aged people to not use drugs of all different kinds, alcohol or something, any kind of substance. And so that's what Francine will be working with. Fortunately, we do have one resignation. Tina Corey has given her 2 weeks' notice. She is our licensed clinical social worker. It was a personal issue. It was not related to the change, that sort of thing. So we are actively looking for additional staff. It's a difficult process, and it isn't just because we're Lakeview. It's everywhere. It doesn't help that we're a distance from most places. Still, we're moving forward. You asked Gerald a little bit about the building. We spent a fair amount of money and a lot of energy. We have replaced the air handling system, so we now have heating and cooling capabilities. So the rooms are not set so that everything's hot, everything's cold, or not necessarily one or the other. We have put in insulation to all the rooms in between the rooms, so that you reduce the sound that is, before it was, you could hear anybody's conversation in these rooms. This next week, we will be putting in the soundproofing that I had talked a little bit about before. We had to have some electrical work done the electrical work. The next part of the electrical work is, because of the nature of the building, I think probably since it was a Pacific Power, they only had 1 outlet per room. If you have only 1 outlet per room, you can't have, you have to have multiple use extension cords, and extension cords are not allowed in a facility like ours. So we're having to put in additional power to each of the rooms. So it may sound a little silly, but we are addressing those issues. We also have some work to do up in Christmas Valley. They have similar kinds of problems in their location. We were asked if we wanted to share space in the North Lake Health District's building, but I'm not sure if that's going to work for us just yet. We're still trying to assess that. We even changed so much of the sound, the ceiling tiles had not been changed, many since the days of the Pacific Power building. So we got that sorted, and we have to change many of the light fixtures because the lights didn't work. So we're getting that addressed. As Stephen said, about 3 weeks ago, we had Credible come in and train, and was unfortunate that in the findings, they found that there were a lot of things that we weren't doing right. So we brought the software to what needs to be current, and there's some additional software components that we will be adding, some expensive, some not so much. But that will allow us to do a much better job tracking who we're seeing, make sure our records are right. Will also greatly assist us in our billing process. We found there were lots of things that we need to do. As Cheryl said, we're not confident in the data that's in the system today. So,
You sent us that dashboard that showed all the countywide data. Do you feel that's fairly accurate or not?
I believe that it is, I can't tell if it's accurate or not. What we were advised is, for years, the MOTS report is a report prepared for the state in every county. And any practitioner, as I understand it, and correct me because you were in the training too if I have it wrong, any practitioner in the county enters into that MOTS report. So it may be somebody from North Lake, it may be more than one practitioner in Lake County who is entering their encounter information. There's also some cases where if a person is resident of Lake County, but is, say, in a foster care, say, a youth in a foster care in Enterprise, or Wallowa, or in Baker City, that counts toward our encounter data. What I was advised, and as I look at the other states, or excuse me, other counties similar to us, our numbers have not been anywhere near accurate. So we are finding out what really we are doing, tracking them, trying to make those reports better. What I want you to see is get a little bit of a sense as we get more and more verification of the data. You'll start seeing a time when we can say, yes, that is accurate. And then we ought to be able to show you trends. Because one of the things we know is that our county has been underserved. There have not been enough treatments by practitioners to residents of the county. And we want to change that.
Yeah, that'd be nice to see if we're making progress.
Charlie, are you aware of them making an intake room at the wellness center? Because they, as far as MOTS data is concerned, I have a weekly meeting with one of my informatics gals and some people at Credible that go over some of the data to determine where are our issues, why are we having issues, where are the data nodes that are lacking. What we did find is that when we have a 28-page, here you go, fill this out, it's overwhelming, especially people with behavioral health issues. And a lot of times they're taking that back to other government agencies and not wasting their time to fill out the paperwork. So Trace and others decided to make an intake room that's right across from them. So they take it, they bring them back there, and they sit them down, and they make it paperless. So basically they're asking them questions, so that if there's a specific data element that's missing, they will get that specifically from the person. So the hope is making the data more accurate, and that was one of the issues that was identified already.
Yes.
So as we're identifying these problems, it sounds like we're uncovering, and then we find one problem, and sometimes we find good solutions, sometimes we just find more problems. And that's good. I mean, because as we peel back the onion, we're going to get much better at what we're delivering. It highlights a possible staffing issue that we might need to address, and that is many agencies use what are called case managers, or case workers. We have not had that in Lake County. So we're looking at, we've got some job descriptions, we're looking at the kinds of people that could qualify to do that. That works in concert with therapists. Many times, the therapist is doing service, their skill set is to deal with specific problems, and sometimes clients' problems are unrelated to that issue. It may be a housing issue, it may be a transportation issue, it may be a child daycare issue. Unrelated, it's important, but it's causing them not being able to meet their appointments or address other. So as we look at our staffing, it isn't just are we looking for specific therapists, we're looking to build a team that will support all of them together. And then integrate that, of course, with our clinics, so that we're working in concert and talking with each other. We are investigating a second location because there has been concern that we have adults and children in the same location. Many people are looking at that, trying to help us identify the kinds of locations that make sense and where the synergies work. So we hope to have a response in about a plan in about 6 weeks. Maybe it may be the 1st of January before it's all said and done, but we're working as quickly as we can to address that. In 2 weeks, Trace and I will be going to the Association of CMHP, the Community Mental Health Facilities. I didn't know we had one, but we're going to go and find out more about what is going on. Normally I wouldn't go, but because there's so much of a learning curve, I want to make sure that I understand the factors that we're dealing with. So, question?
See your sign up, right?
We are working
So
on
John shows the new name.
yes.
Improves the neighborhood.
Whoa. Maybe the neighbors will take heed.
Thank you, Charlie. Personnel, Patricia, Kenny Johnson Fund, Leslie.
Yeah.
Recruiting.
I just want to quickly clarify, I had misstated what we've done historically in making payments for the scholarship. I think it was 2 board meetings ago, I said they receive the funds at the end of the term after they submit their grades. Well, that's not historically how it's worked. How it's worked is that once they pay for their tuition and their books and any lab fees at the beginning of the term, they bring the receipts in, and then traditionally they've been reimbursed for that term. Now, if they don't successfully complete that term, then they're no longer going to be eligible for the funds, and we have to look at a repayment program. But I just wanted to clarify that I misstated the process and how it's been done throughout the years.
What sort of, have we ever had a problem with someone who has been reimbursed and not finished the program?
Nope. We've had folks not do their 3-year commitment, but there has, as far as I know, people have always completed the program. So.
Okay, thank you, Leslie. Mutual aid agreement with the school district 7.
Did you all get a copy?
We all got a copy of it. Sounds reasonable to me.
This is a pretty standard appropriate agreement. It also needed to be updated, which is why we're having through this. So the copy that I have was signed back in May by the school district, so we have that. And I would recommend that we approve this, that you approve this.
Okay, I'll ask for a motion then.
So move.
I'll second.
Those in favor?
Aye.
Motion carries. Medical staff and privileging.
Dr. Hussey must have been tied up, so I think we sent out to you the different individuals that are for their reappointment. Dr. Gilder in teleradiology, Dr. Barrett in urology, Dr. Barrett in radiology. I guess I have 2 Dr. Barretts. And Dr. Andre, teleradiology. We recommend the medical staff approve these. We recommend that that you approve these.
Also move that. Also move.
Second.
Also.
Moved and seconded. Those in favor?
Aye.
Aye. Thank you. Motion carries. Employee recognition.
lots of great people. This individual is, like all, very, very valuable, but is oftentimes the one that brings on a little pain, but is really very helpful, always got our staff's back, is a real patient advocate. And she really makes a difference as people get coordinated through the care that they get. This is Denise Hadley, our phlebotomist lab assistant.
Oh, that's fantastic.
A little pain, you know?
I get it now.
Were you thinking of physical therapy? Is that what you were?
I wasn't sure.
She's always poking fun.
Yeah.
Well, that's very good, thank you, Cheryl. CEO report.
We have lots of things that are going on, as it seems to be quite frequently. First off, next Monday, we are fortunate to have senior members from the Oregon Health Authority coming to visit. You may recall about 2 years ago, we were part of a listening tour where one of the outgoing members of the Oregon Health Authority came to listen to some of the issues that we have. So we have several people that will be coming here. Those individuals are Susan Otter, who's the State Coordinator and Director of Health Information Technology. Marta Markuska, who's a doctorate is involved also in the IT world, looking at our broadband needs and how well our connections are working. We also then have Jackie Fabric, who is coming from, she's the behavioral health policy analyst. So they'll be here on Monday to talk with us about some kind of challenges and issues that we're having in Lake County. We want to make sure that people in Salem and Portland hear from us. So that's a positive. I want you to know that as of 2 days ago, our Governor Brown proclaimed the National Rural Health Day to be November 17th. So we want to remember, and the state recommends that we remember all those involved in taking care of people in our rural communities. So November 17th is the National Rural Health Day. JPIA, we have had a meeting yesterday to talk about the areas that we can work together on, and we have a meeting on next Wednesday to work together some more. One of the things we plan to do is jointly do an assessment of physician needs for our 2 counties, so or 2 regional areas. We've been talking about this for quite some time. We finally got 2 contractors that will give us, that we have proposals from, so they're very comparable, and we hope to have an answer on that and then have that process done. The still undefined as full JPA, Oregon, which is us, Army, the hospital in Burns, the hospital in John Day, and the hospital in Pepper. We will be meeting on the 14th. We are continuing to work at ways that we can work together. The Lean program is one tool. Christy Albertson, our grant writer, is working on another grant to do another linkage between the 4 hospitals in Oregon. So we think we have some good synergies. The hospital in John Day just hired a new CEO. We're happy to have that. They've had a little trouble. They had 3 in the last year, so it's been a little difficult. So we haven't had quite as much consistency as we hoped for, but we're looking forward to that. I think Teresa talked a little bit about our CPR program, how we have, because of our size, we can't give out CPR cards on our own. We have to partner with a larger hospital. We have been working with the Sky Lakes Hospital. We've now transitioned to working with the St. Charles system. And there's a possibility that we could expand that significantly for Lake County, depending on how that moves. So We'll see, we'll tell you more about that as we go. The loan that we have talked about, it looks like if all goes well after our calls today, that I will be going to Portland on Tuesday to sign all the documents and then fund on Wednesday. So we're very, very close. It looks like the interest rate that we locked in today will be 2.91%. So it's gone up a little bit. The risk is that if we don't lock it in now and we wait for a couple more days with the election, there's a risk that it could, nobody knows which way it would go. It could be very good or it could be worse. So if you recall, our interest rate for the bond that we did last year, I believe was 3%. So this is still better than that. So that's very positive. Lakeview Gardens, the construction project, I think I sent out some information about that. I hope that's helpful. I know there's a lot of data and a lot of detail. I think it's just important for you to get an idea of what we're doing. They've been notified that it's been delayed now about 3 weeks. So it will be April 27, 2017, where they had planned on the end of March 2017. I had said I thought it would probably be about mid-April. Now toward the end of April, and you saw the explanation be because of lack of personnel.
Charlie,
I
question.
trust.
The construction, the last item to be constructed to be the assisted living, looks like.
Yes.
Would there be any advantage to trying to go ahead and open the other two buildings before that one's finished?
I don't think so. Part of the reason why is when we take possession, then the warranties begin from that date. So if we have them all at the same date, it makes it easier if we have a problem, or a problem with a boiler, or a problem with a generator, to know all the same date. Secondly, from a staffing standpoint, we don't really want to have half of our patients in one place and half over here.
We don't have any assisted living patients at the moment.
We don't at this moment. But we now have a qualified assisted living administrator, so we prepared for that. So, but we also are sending staff to learn how other small house facilities have operated. So we're getting our staff geared up for that. We're also in the process of buying furniture. So as we buy some types of furniture, if they all get delivered at the same time, it's easier to install. So, one of the things that building them in sequence, that will be a benefit for building A is the first, building B is the second, building C is assisted living C. The bugs got kind of worked out on A, so B and C are moving along quicker. So there's a learning curve in that. I think we've sent you I've sent you most of the changes in costs, a few items as they come along. We're trying everything we can to keep the cost as small as we can, but there are things that are different. Today we had to decide, for example, on the backup generators. The bid versus, the bid was a little bit lower than we had planned on the one that the contractor wanted, but they bid without understanding that the service vendor that comes in and maintains our other generators, we needed to change companies, because, so we went with a Caterpillar boiler, or backup generator, because then that's consistent with what we have for the other, for the hospital. So the maintenance team is able to do all of ours versus having to switch. So we want to make sure that we're lining up our system overall. We changed, at Stephen's recommendation, we changed and had our vendor that has helped us on our computer systems to install wiring rather than use the original bidding company, because if something goes south, that vendor that maintains our equipment throughout the hospital is the same one that's going to be maintaining the Lakeview Gardens facilities. So we'll have better service. That's important. It may cost a little bit more, but we try to keep it as close as we can. Any questions about that?
Is all the landscaping would be in?
When we finish? When we finish,
By
yes.
the time you finish.
Well, I expect so.
Will that happen before we take over the people we put patients in? The landscaping, will that be done in by
Well, there's a combination of types of, so you'll have the sprinkler systems all installed. You'll have the lighting, exterior lighting systems. You may not have all the plants.
That's
So
not
we-
a very good time of the year to plant.
So it depends on the kind of, I mean, there are several components of it, but the main infrastructure will be put into effect. Okay? Any other questions regarding Lakeview Gardens? Next thing, Lake Health Medical Supply. We received our, as we told you, we hired a company to inspect us, make sure that we were right. And we had all the right things done. Their inspection came back without any problems. That was sent to Medicare. Medicare did their inspection a few days ago. No, yesterday.
No, it was yesterday.
The second,
It
I
was
believe it was.
yesterday,
Yesterday.
yes.
Sorry. And that, we received our approval from that, so it should be within 2 weeks, we should be able to have our approval to deliver service to Medicare patients, which means we will be able to deliver services to commercial insurance, which means we'll be able to expand our business. We are actively reviewing an e-commerce contract, so that we will be able to do, sell products on our website. So
California will then let us go.
we are licensed in California. It's just a matter of waiting for our approval from them. Once we have that, we anticipate that within 2 weeks. So that's very exciting news for us. Goose Lake. You asked about whether or not we receive payments from the Medi-Cal. We are at risk for our CCO business. So if you recall, that is the Medicaid business that's been assigned to the Eastern Oregon CCO. So we get a monthly payment for physician services as well as hospital services. Then we take risk for the hospital component as well as for the physician component. That risk says that we live within our budget. If there's any monies left over, then we get some of that money back. So there's a withhold, and then there's some incentive dollars. That's true for both the hospital and for the physician component. Part of that risk pool is some metrics that the CCO wants us to strive for. And so in some of our documentation, we're actively looking to ask patients those kinds of questions, keeping our patients out of the emergency room. We can see them in a more appropriate place, so we have fewer emergency rooms. I think at the last board meeting, I talked about how we got the hospital dollars, we got some incentive dollars. It's quite significant. We received dollars for the physician component, not only in Oregon, but also in our Goose Lake, California business. So the checks we received in the last couple of days for the Oregon CCO business, that amounted to $41,010. And for California, it was $28,400. So that's a significant amount of money for both of the businesses. We have a great opportunity to increase those by the focus that we place by having our staff through our electronic medical record, making sure we're asking the right questions, getting the people that need to be seen for those potentially, many of them are preventative care services. One that no one likes to talk about is the colorectal screening. Sorry, it is one of those screening items, and so the more people we get and have that service provided, the better our chances of getting higher levels.
Now, does that have to be done up here? Can they do it in the clinic down there?
Oh, yes. Oh, yes. It doesn't matter where we deliver that service. What matters is that the service is delivered to those patients. And that doesn't mean necessarily a colonoscopy. That may, it could be an outpatient lab test. So, a little delay in our CT scanner replacement. Turns out Siemens couldn't build it fast enough. So the date of its delivery will be the first week in January. First week in January. It was planned, we had demanded that they deliver it before Thanksgiving and have it installed. We were shooting for the first week of January, or first week of December to have it up and running. Siemens couldn't build it fast enough.
So does that change your replacement, your temporary replacement?
And so because of the delay, we actually are able to secure a better price for the temporary unit. And we had some issues with power. Those are not an issue for this vendor, so we actually saved some. So it's a delay. I'm disappointed that it's not as fast, but these things happen. The clinic remodeling, there will be a board meeting on the 16th where we have put in the paper an advertisement that we are going to move forward on this. That will be the time if there are any public comments, so we'll be available for that. I will not be in that board meeting because I'll be in Eugene, but we'll still hold that meeting. And then I will be sending out to you if you want to see all the details on the schedule for that. Right now, we should be interviewing contractors the week before Christmas. That's to keep us on schedule, just to break ground as of the first week in March 2017. It was a fairly aggressive process. But that's what we've asked CCS to put us on. We'll send out the schedule. Any questions?
I noticed the other day we had a small river and did they break water in when we were putting the
No.
building?
No. What we had to do was have a test of the water to make sure that it met the Department of Health's contaminant review. So they ran water to make sure they had enough through that. We got the lab test back, everything was fine. So they were doing some testing. I hope I have the answers when you ask.
Anything else? Any questions? Do we have any executive session items today?
Just a couple.
All right, we will take a 10-minute recess and then come back and executive session.